It's time for Kadlec on Call on News Radio 610 KONA. It's your chance to learn valuable health information right here in our community. Now, the host of Kadlec on Call, here's Jim Hall.
And a good Wednesday evening, everyone. Welcome to another edition of Kadlec on Call. Every Wednesday evening from 6 to 7 p.m., we come your way and talk about a particular health or medical topic. And you know, in the healthcare world, it seems like every day, if not every month, is some sort of focus on a health-related issue. Probably most notable this October is connected with breast cancer awareness. April, I believe, is organ donation awareness. March, colorectal cancer awareness. And certainly February is heart awareness and heart health awareness. But on this program, it doesn't matter, even though we're getting into the month of February. We try and make the focus every month of the year to live a healthy lifestyle. But tonight, we are going to merge the health and heart topic and talk about really one that I've never had the opportunity to focus on this program. It's a piece of the heart issue, and it's called congestive heart failure. And certainly we've talked about the cardiac heart services that are available here in the Tri-Cities at Kadlec Regional Medical Center. Everything from the diagnosis of heart ailments, how to treat heart attacks, and obviously open heart surgery and things of that nature, and interventional cardiology, but we really have never delved into the topic of congestive heart failure. And so tonight we have two folks who are expert in this area, and they are with Kadlec Clinic Inland Cardiology. Dr. Fadi Al-Kaisi is a cardiologist, and Lacey Sangster is an RN nurse navigator with that practice, and she spends most of her work with Inland Cardiology working with congestive heart failure patients. And so very important topic that I didn't realize how prevalent it is, and certainly with an older part of the population, maybe most susceptible to suffering from it. We wanted to spend the hour tonight talking about congestive heart failure because I didn't realize how many people are impacted by it across our country. So welcome, Lacey. Welcome, Dr. Al-Kaisi. Lacey, why don't we start with you? Maybe give our listeners, first of all, you and I were joking when I asked kind of a silly question of, you hear of congestive heart failure, doesn't that mean your heart is stopped? But really, what is congestive heart failure?
Well, thanks for having us, Jim. Basically, when a patient has congestive heart failure, what that means is the heart doesn't pump enough blood to meet the body's energy needs. So it can cause problems with congestion.
And so that meaning it can be obviously very serious then. And is it usually the result of they have had a cardiac event, such as a heart attack or something major in the heart area, or is it something that maybe they've been living with and it just slowly evolves and all of a sudden becomes a major heart issue for them? Dr. Al-Kaisi?
Good evening, Jim.
Yes.
As you know, the heart is the pump that is responsible for circulating the blood around the body. Whenever that pump fails to receive the blood or to pump it forward, it turns out to be failing condition or heart failure. And as Lacey said, most of the conditions we deal with are the dysfunction of the heart to pump the blood to the rest of the body. On the other side, we have some cases where the heart cannot receive the blood adequately from the lungs, and that can cause congestion and fluid backup in the lungs. So we like to divide them in general as systolic heart failure, which means that the heart is not able to pump the blood effectively forward, and diastolic heart failure, which means the heart is not able to relax to receive the blood adequately from the lungs. Obviously, there are some cases that they may have combination of two kinds of the heart failure.
Is it something obviously then that evolves over time, and is there a golden time, if you will, where it reaches, where it becomes very, very serious as opposed to serious where you really need some major immediate intervention?
Obviously, most of the cases we deal with are slowly progressive development of the heart failure, but there are some unfortunate cases in which it comes rapidly, quickly, that will turn the heart that was healthy heart to be in congestive heart failure. And usually these patients are sicker and they need more attention.
Now, in that latter example that you just gave, what would that mean that they wouldn't necessarily have suffered a heart attack or something like that, or would have they? Is that
it can be associated with a heart attack. The causes of heart failure are multiple causes. They are starting with the most common cause, which is decreased blood supply to the heart. Blockages in the arteries running on the surface of the heart, giving blood supply to the heart. That decrease of blood supply can be sudden, such as a heart attack, that can decrease the function of the heart significantly, and on top of the heart attack, the patient may have congestive heart failure, or that decreased blood supply can be slowly progressive over months and years, causing weakening of the heart muscle over a long period of time.
And is one worse than the other, or are they both equally as serious?
They're both about 50-50. The population has 50-50 of both systolic and diastolic heart failure.
So give me an example of, say, someone that comes to you in your office and you suspect this. What happens next? How do you get to that diagnosis, and then we'll get into how you treat it?
Different presentations for that condition. The most common classic presentation is usually difficulty breathing. Patient who used to do their yard work or work around the house, recently they start noticing that work, the same work that they were able to do, right now for the last few weeks, they are not able to do it without stopping multiple times to catch their breath. Other examples may be decreased level of energy or swelling in the legs. That means water is accumulating in the body, and by gravity it goes to the legs. Or inability to sleep well in bed because they have to catch their breath because the water is building up in the lungs, making them unable to lay down in bed.
Meaning they have to cough from their
correct, and they have to set up. These usually the classical examples of presentation to the heart failure.
Now, when that person, you do what types of testing and work do you do to determine that it is that as opposed to something else?
Usually we like to start with confirming our diagnosis that they do have congestive heart failure. The gold standard testing for that is ultrasound for the heart or an echocardiogram. And that can tell us whether the patient has systolic or diastolic or a combination of systolic and diastolic congestive heart failure. And that can be the first test that we usually do. Then we try to answer the question why the patient has congestive heart failure or inability of the heart to function properly.
Now, and I'm sure, again, it must vary depending upon the patient, but say it's somebody that has a blockage, then might that person be a candidate for either an angioplasty or where they clear the blockage or potentially even open heart surgery?
Absolutely. We start ruling out the most common cause of congestive heart failure, which is decreased blood supply. There are different ways to do that. The most effective and reliable way is coronary angiogram, which is a procedure that we advance catheters through the arm or through the leg to the heart without the patient feeling anything. And we take pictures for the arteries supplying blood to the heart, and that can tell us if the patient have blockages. Those blockages can be opened either with a stent or with an open heart surgery, bypass surgery, depending on the complexity of the blockages. Improving the blood supply in majority of cases improve the congestive heart failure and improve the function of the heart. Obviously, there are certain cases that they are very advanced that improving the blood supply may not help, but those usually the exception.
And that's so if it's not do you have patients with congestive heart failure that aren't candidates for angioplasty or stents or even open heart surgery, and you have to just treat them medically as opposed to surgically and interventionally?
Correct. If the blockages are so extensive and we don't have much of room to help, or the damage, unfortunately, has been so extensive on the muscle that we don't expect a recovery of the muscle, those patients we have to rely on medications only.
Before we go to break, I guess just quickly, Dr. Al-Kaisi, I want to get into Lacey's work as what she's called as a nurse navigator and what that means. But what is the message, I guess, just real quickly as we go to this break for people to think about that might be in this situation, that, like you said, that are working in the yard or they're working in the house and it's not like normal for them. What's your advice for them? Is it go see your doctor? Is that the...
Always my
First step.
advice, whenever you think as a patient something is not going right, seek advice. It takes us a lot of tests and thinking to get to the bottom of it. So don't feel hesitant to come seek help. And many people, they feel that I don't want to just waste time of other people. Never taken that way. We are here to help.
Dr. Fadi Al-Qaisi, a cardiologist here in the Tri-Cities at Kadlec Clinic, Inland Cardiology. He's joined with us tonight live in the studio by Lacey Sangster, who is the nurse navigator with Inland Cardiology. And we're talking about heart care, but zeroing in tonight the focus on congestive heart failure. And we'll be back with more of our discussion in just a moment.
You're listening to Kadlec on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec on Call. Here again, Jim Hall.
And welcome back to the program. Tonight we're talking about congestive heart failure and the incidence of it. It's very serious. And it affects some of the statistics that I was reading today. 5 million Americans live with it. 1 million hospital stays each year are caused by it. And a number of times it results in repeat visits. We have Lacey Sangster, who's a nurse navigator with Kadlec Clinic, Inland Cardiology, and cardiologist Dr. Fadi Al-Qaisi. And Lacey, I want to pick up the stat on that with you, as we were just touching on that. Obviously, it's very serious because patients need to be hospitalized initially, but a lot of times they end up back in the hospital. Why is that?
It could be for a number of reasons why patients end up back in the hospital. Ideally, if we can catch patients in the clinic and give them proper management through the cardiologist and education, we hope to keep them from having to go to the hospital. But sometimes patients can progress and their condition can worsen, and they end up having to go to the hospital, and multiple times having to go to the hospital. So that's kind of where our program got started, is to try to eliminate or reduce, rather, readmission rates for heart failure patients.
And so when that happens, is it because, as you touched on in the first segment, that this fluid builds up in the lungs and they have trouble breathing, and that would require, it would get that severe that there would be the need to get back into the hospital?
Absolutely. So when I meet with patients and I go over heart failure education, I kind of look at it as a toolbox, and in each drawer of this toolbox are tools that patients are going to be able to take home, because once they leave the clinic or they leave the hospital, it's all about self-management. So by giving patients these tools that they can use at home, by eliminating sodium from their diet, taking their medications as prescribed, keeping their follow-ups with their doctors, trying to stay active and participate in some sort of an exercise program. Those are all things that will help patients stay out of the hospital.
And so that is part of the navigation that you do?
Yes, it is.
Now, Dr. Al-Qaisi, to reinforce what Lacey was just saying, those patients, the compliance seems to be critical. And again, if people didn't have congestive heart failure, it would mean that they were living good, fit, healthy, active lives. And so that's the challenge that they're facing. It's because they developed it was probably because some of these habits that we all have of stress and poor diet, and we don't get our sleep, and we don't take care of ourselves. So is that, to her point, really what it's all about, is making sure the patient is fully attentive to what they're doing?
Absolutely. Heart failure needs full engagement of the patient and their families for the care of their condition. The physician or the clinic or Lacey, we cannot do it on our own. We need the involvement of the patient to identify early enough if there has been any worsening of the condition of the heart failure, that we can intervene early enough to keep that patient at home and keeping their usual lifestyle without interruption to go into the hospital, so we can manage their condition more. That's why we have Lacey available with hotline. That's what we like to call it. Phone number that they can call, discuss their condition, express what's going on, and we can give them advice over the phone or facilitate urgent visits to our clinic.
You were both touching on, once, say, someone needs open heart surgery or a blockage cleared, and then they're on that recovery stage and the compliance stage with living properly. But do you find with patients of this kind that they end up, it's once they get back, the compliance is difficult. They get maybe discouraged, or they fall back into their old habits. That's why this need for really reinforcing the need for them to be involved?
Compliance is part of it. It's a major part. But again, as we said, heart failure is a very dynamic condition. There's many environmental factors that can affect and disturb that balance of the heart with the fluid status in the body, such as infection, irregular heartbeats, change in the diet. And that's why we like to be very tentative and very keeping a very close eye on the patients to help them manage their condition. Compliance is very important, but it's not the only part. As Lacey said, also the healthy diet, the watching the salt in the diet and watching what they are eating, keeping healthy lifestyle, exercise, they are all important factors as well.
And is that because to the point you mentioned that if your diet's not right, that can change that balance of that medication that you work so hard to strike the right balance?
Absolutely. Actually, as a resident, we were joking that if you are on call on Thanksgiving, expect a lot of heart failure admissions.
Yeah. So what happens when patients consume a diet high in sodium is it causes the kidneys to want to retain fluid. Well, when you're already having a heart that's having trouble clearing the fluid and working, your body's a very fine balance. All the organs are working together. So when you eat a lot of sodium, you retain more fluid, and it's usually fluid retention, the complications from fluid retention that causes the shortness of breath and the swelling that will cause patients to have to go to the hospital. So that's why we recommend no salt.
So how often when say a patient leaves and you do your education, and then how soon would they come back to you? I mean, is it readily like within a couple months, or could it be as soon as a couple weeks?
It depends. In the initial phase of identification of the heart failure and in the phase which we call optimization of the medications, we usually ask them to come very frequent, maybe like every 2 weeks or every week, to adjust their medications, monitor their status. Once I keep their balance, their more in stable condition, I try to take the back seat and try to observe them every 3 months or 6 months. Mm-hmm. But then I will give the driving seat to Lacey so she can monitor them more closely and make sure there is any problem that she needs to intervene, so I can also be of help if there is any urgent issue.
So if you're in the back seat, as you call it, for that period of time, then are you, Lacey, seeing them? Are you calling them? Are you are they having follow-up visits with you, or how does that work?
Well, I keep a cell phone on me. It's called our heart failure hotline, so patients have contact. They could call me right away if they have worsening signs or symptoms of heart failure. I do education with patients, and I'll do as many educational visits as a patient needs. I do flag them in our system at Kadlec so that if they do readmit to the hospital, I can go and see them.
Meaning if they do, you're notified?
Yes,
wow,
I am.
That's
yeah.
awesome.
Yeah, so
I mean, it's not awesome that they have to come
right.
back, but it is the fact that there's that connection right away that gets right. you to their bedside.
And I help coordinate, when patients do end up back in the hospital, we get them into our clinic within 7 days and get close follow-ups and just really close monitoring of these patients.
Now, do you have them at home? Are they doing like taking their own blood pressure? I mean, or is it just more physical symptoms that they're noticing, and then that's what prompts the call?
Well, patients, when I do education, I go through everything from the disease itself. I go through ways to manage at home, symptoms to watch for, diet tips on how to reduce sodium in the diet. All of the patients with heart failure are told to weigh daily, and every patient's told to weigh in the morning after they've emptied their bladder, before they've had anything to drink, and wearing the same clothing. It's really important to have
a consistent
very
measure.
Consistent, to watch trends. Typically, studies have shown that you're going to see weight gain. You're going to see the scale numbers start to go up long before they start having any of the other symptoms. So if we can get to patients, they can notice and see those fine changes in the trends in their weight. They can pay attention to if they're having increased shortness of breath or increased edema. They call us, and we can get it triaged and taken care of quickly. And patients don't even have to come into the office for that.
And how much of a weight gain are we talking about over how much of a period of time?
Well, I usually tell patients 3 pounds in a day or 5 to 6 pounds
it
in a
can
week.
fluctuate that much?
It can, yes.
And that quickly?
It can.
Interesting.
Yes.
And so then they would either come back and see you, or you would return to the front seat.
Right.
Absolutely.
Now, if it's something that it's not, they're just having some minor symptoms, a small amount of weight gain, we can do stuff over the phone. If I feel that they've progressed, something more serious, they need to come in. All of our cardiologists are great to work with and work for. They'll see the patients as, if they need to. We're currently looking for a mid-level, so we eventually hope to have somebody in the office that can also help and see these patients. And I can see these patients too and just make sure they're doing okay.
Always the message is fast weight changes is not because of the regular fat-related weight. It's fluid. And we always joke around and we say we have the best weight loss program. We can make the patient loses 20 pounds in a few days, and that's usually fluids.
Just from the accumulation.
Because of the congestive heart failure.
Oh, my gosh.
In nursing school, I learned that 1 liter of fluid weighs 2.2 pounds. So when you look at fluid accumulation, if you've got 6 pounds extra weight gain, potentially you could have 3 liters of fluid, that's going to cause problems.
So obviously the advice is to act on the symptoms and be a compliant patient. When we come back, we have to take another break at the bottom of the hour, but I want to get into a little more detail on some of these, who does it affect, men or women more? Does it, older, younger? How does that work? And I want to get into that discussion here in a little bit. But you're listening to Kadlec on Call. We're visiting tonight with Dr. Fadi Al-Qaisi, who is a cardiologist here in the Tri-Cities with Kadlec Clinic Inland Cardiology. And Lacey Sangster is a nurse navigator in the same practice. They're located over in the Specialty Physician Office building at 1100 Goethals in Richland. And certainly, if you have any heart-related issues, this is the place you want to be, and these are the people you want to talk to. Have to take our bottom of the hour break. Back with more of Kadlec on Call in just a minute.
You're listening to Kadlec on Call on 610 KONA. This program provides general information only. Any comments or information presented are strictly for educational purposes. Kadlec and 610 KONA do not endorse any of the suggestions made by the presenter or callers. Now back to Kadlec on Call. Once again, Jim Hall.
Fascinating discussion tonight on the subject of congestive heart failure, an ailment that affects 5 million Americans across the country. It accounts for 1 million hospital stays each year and many repeat hospital visits. And I think we were talking about a statistic on the financial side of healthcare that it results in $32 billion a year of increased healthcare costs in this country, which is certainly that's not the focus of what we want to zero in on. Why? But certainly there is a financial impact for this most serious disease relating to heart disease. But we have two experts here to share their expertise with us and with you. Lacey Sangster is a nurse navigator at Kadlec Clinic Inland Cardiology. Dr. Fadi Al-Qaisi, a cardiologist there. And we spent the first half of the program going way into what congestive heart failure is, what causes it. We touched on the major causes, but Dr. Al-Qaisi, why don't you pick up? I know there are other reasons that result in how someone will end up with congestive heart failure.
Absolutely. There are many reasons. The most common reason, as we said, is decreased blood supply to the heart. There are other reasons, such as the valves of the heart. They might have some problems, either narrowed valves or leaky valves that can put extra burden on the heart muscle, leading to congestive heart failure. There are diseases that can affect the muscle directly, such as what we call them collectively as cardiomyopathy. They can be related to infections, such as acute viral infections of the muscle, or congenital diseases, congenital cardiomyopathy, either hypertrophic cardiomyopathy or weakening of the heart muscle, disease of the covers of the heart, such as the pericardium. The other reason is irregular heartbeats, fast heartbeats that goes undiagnosed for many months, causing the heart to beat in a fast pace for a long period of time, ultimately leading congestive heart failure. The other reason is alcohol. Excessive alcohol use can cause congestive heart failure. The good thing, it is one of the reversible causes.
And I was going to say, is it something that once you have it, that you just have to treat the symptoms and live with it as best you can, or can you restore and improve your quality of life if you have it?
Absolutely. Many of the congestive heart failure are reversible if we can identify the reason and we can treat that reason, such as arrhythmia. If we reverse that arrhythmia, there is very good chance of recovery. If we improve the blood supply, if we treat hypertension. Lacey was talking in the break about how hypertension is one of the important causes for congestive heart failure. If we control that blood pressure, if we fix the valve problem, that can all lead to improving the heart failure. Even if the heart muscle stay weak, we can improve the lifestyle. We can improve the exercise tolerance, what the patient can do at home.
Mm-hmm. And does it, we've touched on the numbers of cases. I'm curious, does it affect it? Because I know when we talk about heart attack and heart health, that symptoms of heart attack are, they affect men and women differently. Is it the same with congestive heart failure, or is it older, younger, or is there an ethnic connection to any of this? Or maybe break that down for us if you could.
Majority of the patients that we deal, myself, Lacey, and the other cardiologists, are mainly elderly, just because of the prevalence of the factors that can affect the heart. But we have also the good share of young patients who also suffer from that condition.
For the younger patients, I don't mean to interrupt, but for the younger patients, is that mainly because of the hereditary nature of a
Usually
family
it's
history?
Other factors rather than coronary artery disease and decreased blood supply. More it is the familial part of and what we call the idiopathic, which is a terminology for unknown reasons, which is the familial cardiomyopathy, that usually play a major role in the younger population, in addition to the few cases of the infection and the viral infection of the muscle of the heart.
But you picked that up, though. You were talking about, the elderly population, but you do see younger patients. But does it affect men and women in different ways, or is it just equally?
Usually it is equally. I'm not sure, Lacey, what do you see in the clinic on your end?
It's pretty equal. I see both men and women, like Dr. Al-Kaizi said, elderly patients. I would like to add, there are a few patients that had a history of drug abuse that can end up with heart failure that I've seen. So,
but I want to return to the point you were touching on that you called it is reversible. So it's not like something that, I know we've always heard with, the treating a heart attack that's why they want you to call 911 and act on the symptoms right away and don't drive yourself to the hospital and all of those things. But, because what's the old term? Time is muscle, I think I've heard the cardiology world say. But is there, if you're diagnosed with congestive heart failure, that doesn't mean you may be failing, but that doesn't mean you have to stop.
Absolutely not. Congestive heart failure, we always say that our goal is to improve survival and to improve quality of life, which is very important. And many actually of the treatments in the congestive heart failure world is connected to improving lifestyle and not just improve the muscle as a pump. Mm-hmm. So many of the cases of congestive heart failure are reversible. As we said, if we improve the causing agent, the heart muscle will improve. In addition to that, in most cases, obviously, and with the proper medications, with being aggressive with the medications, and having the buy-in for the patient. Because as we said, this is a disease that the patient has to be involved in. That's why even if I give the message during my visit, I emphasize that the patient has to go and sit with Lacey for the 45 minutes, listen to the education, listen about the importance of following the instructions, and and listen more about, because repeating the message is the key here. Because once the patient gets compliant with the medications, follow the plan, there is a very good chance of reversing that condition. And as we said, medication is one part of the management, and we can we always tell the patient we have a lot of tricks in the bag that we can pull to help.
To that topic of tricks, as you call it, obviously medicine is just there are breakthroughs every day, and whether it's cardiology, cancer, any kind of healthcare and medicine. Is it the same in your world of the medications that have evolved that are today here that you just did not have available to you 5, 10, obviously even 20 years ago in the cardiology world, that there are things out there that can really help these patients?
Absolutely. If we look back over the last 20 years about the curve of the mortality of heart failure, patient dying because of heart failure, the curve is just going down, and less numbers are dying just because of the introduction of different medications every few years that will help those patients.
So that's why you said this vigilance and this compliance, because talk to me a little bit about that medication. You said there is a really fine line, and you touched on the things that your lifestyle factors that can really throw your body off kilter and put you back in the hospital because of this disease. How do you determine that on what is the right medication and what is the right dose of that medication?
Usually the medications are well established in the world of cardiology. There are certain medications that everybody agrees we call the standard of care that we need to introduce these medications for. And they have been tested in multiple trials, and we like to push for these medications to the recommended doses. And I know that I find sometimes I spend sometimes convincing my patient that these medications are different from the traditional heart hypertension medication that we need to target certain number of the blood pressure. On the contrary, we have to increase these doses of the medications regardless of the blood pressure readings. And many patients, they will look at me with wide open eyes when I tell them double this medication while they are having absolutely normal blood pressure, because the more medication we can add these patients targeting to the recommended doses, the more benefit they can derive. Obviously, when the patients start to develop side effects of lightheadedness, dizziness, they are not able to function during the day, then that's the time that we need to stop and tell them that's your maximum dose.
So then that's when you would call Lacey's hotline.
Yes, I would.
Absolutely.
Yeah, the medications that we have these patients on, we're okay with patients having a low blood pressure. Like Dr. Al-Kaisi said, as long as they aren't having any dizziness or lightheadedness. And, we just want patients to monitor that and keep an eye on it.
Mm-hmm. We have to take one more break. I want to touch on before we go. We talked on how important it is for the patient to really embrace what they're going through and be vigilant and compliant. But I want to touch on a little bit, too, on it kind of goes to the mental health side of just how important it is to, this is serious stuff that they're dealing with, and to have a good positive attitude in how you would deal with something like that. We'll do that when we have our final segment of Kadlec on Call. Stay with us. More of Kadlec on Call in just a moment.
You're listening to Kadlec on Call on 610 KONA. This program is not a substitute for direct consultation with your own healthcare provider. Always consult your healthcare provider for your specific condition, especially if you have or suspect you may have a medical problem. Now back to Kadlec on Call. Here again, Jim Hall.
Just a few minutes left in the program, talking tonight about congestive heart failure. Fascinating topic. One of the reasons I enjoy doing this program so much is it's only an hour, but you learn so much. And I certainly know a lot more about congestive heart failure tonight. We have Dr. Fadi Al-Kaisi and Lacey Sangster from Kadlec Clinic, Inland Cardiology. And just a couple of minutes left, guys, and I just want you to touch on some of these other ways that congestive heart failure is treated before we leave the air, Dr. Al-Kaisi. And then I want you to leave enough time to where you can each kind of maybe send a takeaway message home for our listeners who might be one of those patients that haven't had it diagnosed yet, but might be a candidate for it.
So, as we have said, medications is the cornerstone for any treatment plan for patients with congestive heart failure. But sometimes medications may not be enough. The heart failure is not reversible. We cannot reverse that condition. The medications are not getting good lifestyle for the medications. There are other methods that we can use. Some of them, there are what we call resynchronization therapy, which is a device that can be implanted under the skin with wires to the heart. It can serve two purposes. Number one, protect the patient from irregular heartbeats that can be fatal, which people with congestive heart failure are susceptible for. In addition to that, it may restore the harmony between different walls of the heart so they can beat in more harmony and strengthen the heart muscle, improving the symptoms of the patient. Obviously, there are certain patients who are candidate for that. Not everybody is candidate for that. Other methods we can think of is what we call artificial heart, or short for LVAD, left ventricular assist device. There are certain pumps implanted under the skin with hoses attached to the heart that will help the heart to pump more efficiently and share the load with the heart. Obviously, these methods are not available in the Tri-Cities, but we can have the patient transferred to other centers that can do that. The ultimate and final treatment for heart failure is heart transplant. Heart transplant in the United States, the major problem, major limitation is availability of donors. The pool of donors is very limited, so not everybody can get a heart transplant. The waiting list is long. That's why we have to have very strict criteria to select the patients who can qualify to the transplant, and obviously we have to send them to a bigger center because there are only few centers in the whole U.S. which do heart transplant. If we cannot do any of that or the patient is not candidate for that, then we shift our philosophy of care to concentrate more on what we call comfort care. Make sure that the patient is comfortable, having good symptoms, and maybe change our philosophy from concentrating on labs, weights, calling Lacey all the time. Just make sure that they spend good quality of life at home.
Finally, and I guess that probably segues to a final comment from each of you, is, and we've touched on the importance of being compliant as a patient, but how important is it to, regardless of where you are in that spectrum of some of those cases, whether there is no further treatment that is available to reverse it or not, but how important in any of that situation is the importance of having a good caregiving team as well as a good positive attitude and approach to dealing with this? Start with you, Lacey, and I'll finish with you, Dr. Al-Qaisi.
Well, I think it's always important. If I have one piece of advice, a takeaway advice for these patients, like we've been saying, this whole program is self-management at home. And I would tell people out in the community that if you notice any changes, maybe last week you were able to walk from the kitchen to the living room and now you're having shortness of breath, or you're noticing that you're having swelling in your ankles, those are not normal things to have. And a lot of patients will go a very long time before they seek any care. And so it's really important, especially with heart failure, that you get into your doctor, your primary care doctor, or if you already have a cardiologist, get in to see them as quick as possible so that treatment can be started. So you have that team to help you with your goals, ultimately, which is to live longer.
Mm-hmm. And Dr. Al-Qaisi, maybe 20, 30 seconds.
The heart failure management is a team approach. Multiple players have to chip in to get good care. The most important player in the team is the patient himself or herself. They have to be involved in their care very, very, very well. And we are here to help. If they need any, if they are suspicious of anything, seek help, and we are happy to help in any way we can.
Well, it's just amazing to me to see to learn about stuff like this every week. And interestingly, if folks have been around the Tri-Cities long enough to see how cardiac care in this community has advanced over the years, you think back to 2001, there was nothing that existed for interventional side. You had to go out of town for that service. And now we've had that program for almost 15 years. So great work. And thank you so much for sharing your expertise with us today. And thank you for listening to Kadlec on Call. Have a great week. We'll see you back here next Wednesday night.